Hi, I'm Dr. Jennifer Wiler, Professor of Emergency Medicine and Business at the University of Colorado, and I am presenting on behalf of Kirsten Rounds, Becky McGowan, and Jeanette Baird. Our project was entitled Disparities in Gender, Representation, and Salary in Emergency Medicine Leadership Roles. This initial data was presented at the Association of Academic Chairs in Emergency Medicine, and the Academy of Administrators in Academic Emergency Medicine annual retreat for each of the years that the data was collected, as well as the SAEM annual meetings of each of the included years. We had no financial support, and none of the authors have a conflict of interest to disclose. Emergency departments have had a variety of formal leadership roles. This study seeks to determine if there are a gender gap in leadership roles and in the associated salaries of women in those leadership roles. A secondary aim was to determine if there's a gender difference in the domains of roles held by emergency medicine physician leaders. This was a successive, cross-sectional, observational study of U.S. emergency departments using the Association of Academic Chairs in Emergency Medicine and Academy of Administrators in Academic Emergency Medicine member surveys from 2013, 2015 through 2018. The descriptive statistics are reported and assess differences in gender representation and salary, which was conducted using linear generalized models with rank, years as faculty, region, clinical hours worked, and academic versus community ED as covariates in our model. Separate regression models for male and female salaries across time and leadership roles were also estimated. There were 9,620 responses from 154 academic and community emergency departments. Female emergency physicians represented, on average, 34.4% of responses per survey year. Across all survey years, the percentage of women in leadership roles was significantly less than men at 44.5%. Women were least represented in executive leadership roles across the 5 survey years at 9.7% as compared to males. But females were noted to be significantly more represented in educational leadership roles at 18.5% versus 13.7%. Within each leadership role, after adjusting for model covariance, female salaries were significantly less than males, and although salary growth was significant over time for both males and females, females in leadership roles had a significantly lower salary than males at each of the 5-year time points that the data was reported on. These salary differences averaged across the 5 years and were $57,150 for executive leadership roles, $27,280 for operational leadership roles, and $19,177 for educational leadership roles. Based on this study, we conclude that across the United States, there's a significant lack of women in emergency medicine leadership roles, and in particular, executive leadership positions. We also find that there is a large, unexplained salary gap in all leadership domains, which is currently, again, unexplained. Thank you.